Hello, my presentation about alternating syndromes. Alternating syndromes, especially alternating hemiplegia, is a form of hemiplegia that has an ipsilateral cranial nerve places and contralateral hemiplegia or hemipresis of extremities of the body. The disorder is characterized by recurrent episodes of paralysis on the one side of the body. There are multiple forms of alternating hemiplegia, like WEBER'S syndrome, Fauville syndrome, or middle alternating hemiplegia, and inferior alternating hemiplegia. I will explain them in next slides. Next, diagnosis of alternating hemiplegia. There is no diagnostic test for alternating hemiplegia, which makes it very difficult to diagnose. Also, because alternating hemiplegia is extremely rare, it's frequently missed and the patient is often misdiagnosed. Proper diagnosis, however, is critical for early treatment of the disorder. But also there are some criteria that can help in the proper general diagnosis of alternating hemiplegia. For example, diagnosis of WEBER'S syndrome, because it's the only form of alternating hemiplegia that is so easy to diagnose beyond the general criteria. Next يا أحمد. WEBER'S syndrome. WEBER'S syndrome or midbrain stroke syndrome or superior alternating hemiplegia is a form of stroke that affects the medial portion of the midbrain. It involves oculomotor fascicles in the intrapeduncular cisterns and several peduncle, so it characterizes the presence of an ipsilateral lower motor neuron type oculomotor nerve palsy and contralateral hemiparesis or hemiplegia. Next, this is explaining pictures. Millard-Gubler syndrome or MGS is one of the classical crossed brainstem syndromes characterized by a unilateral lesion of the basal portion of the caudal bones involving fascicles of abducens, cranial nerve number 6 and facial cranial nerve number 7 and the pyramidal tract fibers. Next, Fauville's syndrome or inferior medial pontine syndrome is one of the brainstem stroke syndromes occurring when there is infarction, where there is infarction of the medial inferior aspect of the bones due to occlusion of the paramedian branches of the basilar artery. This infarction involves the following: corticospinal tract, contralateral hemiplegia, medial lemniscus, contralateral loss of proprioception and vibration, medial cerebral peduncle, ipsilateral ataxia, facial nerve nucleus, ipsilateral facial weakness, abducens nerve nucleus, lateral gas paralysis, and diplopia. This is for explain also. And thank you for your attention.
Good.